Welcome to Patient Requests to Amend the Health Record Drill. I'm Dr. Michael Warner with Patient Advocacy Initiatives. Before we get started, please answer 3 quick questions. To conduct a request to amend drill, please consider 3 scenarios. 1, an MRI is ordered of the left shoulder instead of the right, and the patient discovers this when he or she reads the order the day after a visit with you. 2, patient calls the office and complains that the information discussed during the last visit with you was not completely documented in the health record. 3, patient arrives at your office with a prehistory, with the intent to submit it as patient-generated health data and to also submit it as a request to amend the health record. So let's go through these scenarios. Regarding the MRI, this is a laterality error. How will your staff remedy the MRI order? Is it an easy fix, or is there a chance that another error could occur? Does the staff member need to notify you? Do you need to change anything in the patient's health record? To create a sense of urgency, what if the patient discovers the error on the way to the MRI center? Scenario 2. Imagine such a telephone call being directed to any of your staff members. How would each respond? Is the patient offered a request to access form, or will the staff member contact you? And if you are contacted, what should the message say? If a request to amend form is submitted, how does it get to you? Where is it documented in the health record, and what is your written response process? Should you make the correction, who is going to review the patient's health record access log and notify other health members caring for the same patient? And lastly, does everyone on your staff understand the rules? In other words, do they understand that you as the provider are responsible? And scenario 3. What if a patient submits a prehistory in anticipation of a medical encounter? If you practice in an office, then what if a patient greets your front desk staff with a prehistory? Is it accepted as an amendment to the health record, or do you tell the patient to fill out a form and wait to see if it's accepted within 60 days? In accommodating patient-generated health data, you want to establish a pre-rehearsed flow of events in your office that does not create barriers to your ability to practice medicine. One way to accept a prehistory is to immediately scan it as a portable document format, PDF, into the EHR and label it as prehistory, followed by the date. If you have paper health records, then it can be attached to your encounter note. Transcribing the information in the prehistory into the appropriate fields is a task that you, the doctor, can do, but it may be more appropriate to delegate this to another member of your healthcare team. You need to ask yourself, do you have the time to do this? If you are a small office where you weigh the patient and take the blood pressure, then the duty of transcribing the prehistory into the EHR will likely be your job. And that's okay. You will find it helpful to review the case and build upon the patient's prehistory. If you delegate this task, be careful how you frame the duties. Accepting patient-generated health data and accommodating a patient's right to request amendment are now duties expected of our medical practice. Capturing patient information and entering it into the health record can be seen as allowing patients to best express their concerns and their needs for medical attention. The history grid of chief complaint, history of present illness, status, review of systems, past family social history has plenty of detail and is the standard. Staff members should refrain from altering or objectifying patient testimony. Small data research will likely tell us that the words patients use to describe their experience will be meaningful. If, for example, the patient describes vomiting bright red blood, the collection of information should not substitute hematemesis. Let the patient's words stay true. To complete this exercise, you can encourage one of your staff members to complete a fictitious prehistory and then have staff members accommodate it as a request to amend the health record. I encourage you to run these drills at your practice and share your results with us. Thank you for participating in this module. Kindly answer 3 quick questions, and I'll see you at the last module.